Hey, this is Dave Sherwin with Dr. Kepo'o. Welcome to the Easy Wellness Podcast. And today we've got a subject that's right up your alley.
That's right.
Chiropractic. And I think there's a lot of people in this country that probably haven't used chiropractic, don't even realize how great it could be and how much money it could save them, that have probably tried a lot of alternative remedies for chronic conditions, whatever the case might be. They may not even know about chiropractic. Do you still have a lot of people coming to your clinic that are just discovering it for the first time?
Yeah, I am amazed at how many people are out there that still think chiropractic is like just some weird quackery, you know? And they don't realize it's an actual medicine out there that they can use to help them out.
Well, being from Canada, I never had that impression because in Canada they're fairly advanced, I think, in a lot of ways with alternative medicine. For example, back in 1989, I got a repetitive motion injury in my back when I was in Canada, and workers' comp covered chiropractic and therapy. The two went together, and that was just the way it worked. And then we moved to the States, and we were surprised that chiropractic hadn't been embraced in the same way. As a matter of fact, sorry for the story, my wife one day woke up just after we moved to the States and just slept wrong, whatever, on her neck, and she could not turn her head. She could turn it one way, but not the other way. And if she tried, it was painful, and it just was a weird thing. She didn't remember an injury or doing anything the previous day. She woke up with this neck pain and couldn't move her neck properly. And we went to the doctor, of course. That was our first reaction, go to a doctor. And the doctor says, okay, put on this neck brace, ice it now and then, and take this medication for the pain, and it should go away soon. And so she put on the neck brace, she started icing it, started taking drugs. And a friend of hers saw her with the neck brace and said, what's up? She told her, so, well, you got to go see my chiropractor. She said, well, I'll try anything. So she went to see the chiropractor who did a quick diagnosis of her neck, did an adjustment of her neck at the root, treated the cause of the problem, and she walked out of there without the neck brace and stopped taking the drugs and had a little bit of pain. Still, it wasn't instant, it wasn't magical, but he treated the cause, and within a very short period of time she was back to normal. She was immediately able to turn her head.
Oh, nice.
So the adjustment immediately biomechanically corrected the problem. This has been my experience time after time. Doctors seem to love to treat symptoms, not causes.
Right.
And one of the reasons I like chiropractic is because I'm not that way. I'm not interested in covering up pain. I'm interested in finding out why I have pain and getting rid of the cause.
Right.
And in chiropractic, you've talked about neck pain as being one of the things you see a lot, back pain. So over to you, what are all the benefits? Why do we do chiropractic? How did it all start? How about that? How did chiropractic start?
That's an awesome place to start. In fact, it started with someone who had some neck issues but didn't have any pain. D.D. Palmer is the original doctor who started chiropractic, and he was actually at a university studying the effects of magnets and how they can help heal the body. Well, it happened to be that the janitor of that university that he was at, named Harvey Lillard, he actually came in one night while D.D. Palmer was doing some work, and they started talking a little bit, as much as they could, because Harvey was actually deaf.
Okay.
So he could hear a tiny bit, and he could communicate a little bit, right? So, but come to find out, Harvey actually had one day trying to lift a really big heavy barrel, and his neck popped when he lifted it, and his hearing went away.
We've all had something like that.
Yeah.
Lifting, moving, getting out of the car, some bizarre thing happens. We feel like something's out.
Right, exactly, yeah. But in this case, Harvey actually had deafness.
Okay.
He lost his hearing.
Wow.
So Dee Dee was actually saying, can I look at your neck? Let me take a look. So he was actually examining his neck, and he found an area where it felt like the bone was just way out of place and sticking out. And so D.D. Palmer did an adjustment on that part of his neck, and bam, Harvey got his hearing back.
Wow.
And so they all of a sudden thought they had this cure for deafness, so they started adjusting all these people's necks that were deaf.
Yeah.
And guess how many people got their hearing back?
How many?
0. Because they didn't have the same
It
problem.
was unique to him.
Yeah, it was very unique to Harvey. So, but what they did find is that all these people started having their neck pain went away, they were sleeping better, their stomach pains were going away, they were just having an overall better experience with their health. And so that's where the nervous system comes in place with chiropractic. Chiropractic is really good at restoring the nervous system balance of the body.
Okay, so on the biomechanics, for me, and for most people, we tend to have our shoulders hunched forward. Over
Right.
time, as we get older, we have problems with our back, we lift things wrong, knees. For me, chiropractic is an ongoing thing. I go once a week for chiropractic, sometimes twice a week, depending on how heavy my training is.
Right.
And it has really helped me. It has helped me be preventive, because I think a lot of times when people are not getting their biomechanics correct, shoulders back and down, lift with your legs, use your back correctly, and you're not keeping everything in alignment, you're more likely to lift that barrel and have a problem. It's those
Right.
freak things. I can't tell you how many people I know that have gone to a chiropractor after getting in or out of their car incorrectly, stepping down a stair just wrong. And I don't think it's the stair that just did it. I think that their body was already a little bit out of whack, and it just needed the tiniest little shove in the wrong direction, and boom, they now have pain that they could have avoided if they were proactive about their biomechanics.
Exactly. In fact, one word that we give that, we call it a non-supportive move. And so someone will move in a way that their bigger supportive muscle groups are not ready for, because they're not trained, they're out of shape, et cetera, et cetera. And so they do that little thing where they bend over to pick up the paperclip and oh, my low back, right?
Right,
It's
right.
because those big muscles were not ready for that movement, so they couldn't stabilize the spine to help them prevent that slipping of the disc or the facet joints or whatever it is that hurt them.
So whether you're currently having a pain from something like that, or you want to prevent pain from something like that, you just want your body to always be at its best, ready to function. Chiropractic is both a proactive treatment people should be doing,
Exactly.
and a reactive treatment. You're having current symptoms, go see a chiropractor. So anything else you want to add on biomechanics or nervous system?
No, the biggest thing probably that goes into this is a lot of people wonder, well, then how often should I be getting adjusted?
Right,
Right? Because I have a lot of patients, they'll say, I only go in when, it hurts.
right.
And that's
That's how most people maintain their car.
yeah.
Something breaks down, they don't like to every 3,000 replace the oil. They'd
Right.
rather replace the engine every 60 or whatever
Right.
the case may be.
Exactly. In the case with your body, though, and chiropractic, when you get hurt, you usually have to be seen 3 or 4 times a week for like a month to get over that injury.
Right.
Whereas if you're doing what you're doing, come in once a week, just maintain where you're currently at, you won't ever have to go through that process, unless you get into a car wreck or something big like that.
And I'm super active. I work out every day. Does everyone need once a week?
No, not everyone. In fact, that leads us into this finding an awesome chiropractor. Okay?
Right.
If you find a good chiropractor, he'll know or she will know exactly what you need depending on your physical activity, your experience with chiropractic in the past. There's a whole bunch of different things that go into that. And
Right.
if you find a good one, they'll know exactly what that is. But most people, I would say, need something for like once or twice a month.
Okay.
Yep, that's perfect for maintaining really good health.
And
For
maintenance
you-
is cheaper than fixing problems later.
Exactly.
Right.
Exactly. So, but now I have a couple rules in relation to finding an awesome chiropractor.
Right.
Okay. One is you need to find one that understands that the nervous system controls the whole body, and that's why they're adjusting you, to make sure your nervous system is balanced.
Okay.
Okay. So a lot of people call those chiropractors subluxation-based chiropractors.
Right.
Okay. The other one is biomechanics. The chiropractor needs to have a really good understanding of the biomechanics of the body. There's one technique that I practice personally is called CBP, or Chiropractic BioPhysics. It's all about how the spine moves in a 3D motion and getting it to move in that 3D motion properly. So those are 2 main rules. Make sure they understand they're doing you justice with your nervous system, and they understand the biomechanics of the body outside of what they learned from school.
And you don't want to put words in their mouth. I mean, when anyone, I mean, it's a business. If anyone contacts someone and says, "Hey, do you do this and do you do that?" chances are they'll say, "Oh, yeah." But I suppose the better way to do it would be to call and say, "What is your focus?" I mean, what are
Exactly.
the right questions a person should ask?
Yep. The main 3 questions I have people ask are: 1, do you adjust babies?
Okay.
If they adjust babies, they say yes. It's because they have an understanding. Everybody has a nervous system, right?
Right.
So if you've got a nervous system, you need to be adjusted.
Right.
And so that's one rule right there.
Okay.
The other rule is, do you know what a subluxation is?
Okay.
If their staff doesn't know what that is, then the chiropractor's not teaching their staff about the importance of the nervous system.
Right.
Okay? And then the other one is, do you allow me to get adjusted as often as I want? There's some chiropractors out there that will say, no, I'll only see you once a month, I'll only see you once a
Okay.
week. If that chiropractor will allow you to see as often as you want, 5 days a week, something like that, then that chiropractor, again, understands your biomechanics need to always be adjusted, and your nervous system is important to be balanced out every day.
Okay, so one of the fundamentals of health, chiropractic, biomechanics, nervous system. Of course, if you're in Utah, contact ohanachiropractor.com. Dr. Kepo'o is one of the best. He's my chiropractor, so it's so easy for us to do this particular episode because you have that expertise. If you're outside of the state, you can still contact Dr. Kepo'o's office because you have a network and you know some people that you could recommend. And otherwise, use those questions to find the right chiropractor for you. Any closing thoughts, Dr. Kepo'o?
No, I just think, use chiropractic in a way to help keep yourself balanced, and you'll find that you just have a much better quality of life with your health.
Okay, this is Dave Sherwin with Dr. Kepo'o wishing you health and success.